Yeah, Eric Naumburg again. Just to address the question of why doesn't everybody in the United States have health insurance? I mean, every other wealthy country has health insurance. Canada, our neighbor to the north, has health insurance. Every country in Europe, Japan, Taiwan. And why do we have a health insurance system that is doing so poorly? We rank, according to the World Health Organization, we rank in the, I think it's 46th now in terms of healthcare outcomes. That would be things like life expectancy, infant mortality, preventable deaths. Those are deaths that would not have occurred if adequate medical care had been available in an appropriate time space. And it's because we have so many uninsured people, and it's because we have a private health care insurance system, and our health insurance system is run more based on what is good for the bottom line and not so much what is good for doctors and patients. We have an estimated 45,000, depends on which study you look at. We have an estimated 45,000 deaths a year or more because of people not having insurance. More than half of our bankruptcies are for medical bills, which in Europe, the head of the medical insurance trusts over there in Switzerland was asked, do they have medical bankruptcy in Switzerland? And he said, that would be immoral. He's right. It is immoral. People should not. We're a wealthy country, and people should not be unable to get care. But it's because we have such an expensive and mismanaged system. So, and the other thing is that you wouldn't believe it based on the what you currently hear, but a Medicare for all system, which would be like a single-payer national health care system, which Medicare is one of our two most popular programs along with Social Security. Medicare for all is very popular. It runs in national polling 60 to 65%. People say they would support that. Even in one poll, even when people were asked if they would be willing to pay for such a system with increased taxes, the response was still 55% in favor. So we have a situation where people want this, politicians, because of who they're beholden to, do not. And so the answer to this is to build the people's voice, which means building more grassroots voices, which means more direct discussion, which is why we have started our Healthcare for a Human Right campaign, because we want more voices to be heard. In my case, we want more voices to be heard in Annapolis, where we think we can get a single-payer system passed for the state of Maryland, like they did in Vermont. Even though it hasn't been enacted, they have passed legislation that will lead them to single-payer, possibly by 2017. So, thank you.